You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to look years younger without surgery. With us, we have registered nurse Adrienne Bloom. Adrienne, welcome to the program.
Thank you, Randy. Glad to be here.
Now, we've had you on the program before.
Yes.
And for people that don't know, she works at the Cosmetic Surgery Institute of Palm Desert with plastic surgeon, I guess that everybody knows, Dr. Mo
Dr.
Zachary.
Mo.
And I've had you on the show at least 2 or 3 years ago.
About 2 years ago.
Back then it was just esthetician, taking care of skin.
Yes.
Now you're doing lasers and you're an RN.
I am an RN now.
So what is your role?
I do chemical peels, I act as an esthetician, and I also double as a registered nurse doing laser treatments.
Now, at the top of the show, we said you could look years younger without surgery. Do you believe that?
Absolutely.
With lasers and things like that?
With lasers, skin treatments, just refreshing the skin. You know, nowadays it's so great because there's so many different options that you can take with the technology advancing and just what's out there. And sometimes it can be really overwhelming. I sometimes get overwhelmed myself sometimes, but it really can make a difference with the skin.
So who is the typical patient? When should somebody get a fractionated laser?
Well, that's a great question. I get asked that all the time. I get treatments myself. People always say, why would you have a treatment?
Because you have great skin. Yeah.
Thank you. I never used to. It's constant maintenance and taking care of it. But people always ask, you're so young, or your skin, you already have good skin. Why fix it? And Dr. Perricone.
That's right, he wrote the Perricone Principle. The dermatologist, right?
The dermatologist wrote the Perricone Principle, world renowned for anti-aging. He stresses the importance of starting to stimulate the collagen early in your life. So 20s, 30s. 20s may sound a little young, but with time, I mean, you think about your skin now when you were younger. You know, you fall asleep and you have a wrinkle on the face, it goes away in a couple hours.
That's right.
Right? Well, when we age, not so much anymore. That wrinkle tends to stay there. So by getting laser treatments or stimulating that collagen earlier in life, you have a bigger surplus. And with time, the skin will just keep continuing to build and to grow.
So with fractionated lasers, so I understand this correctly, it's not like you're peeling off the skin, the wrinkles. You're actually heating the underlying skin and it fills in the wrinkles.
Exactly.
With collagen.
Exactly.
Is that right?
Well, we're creating little microscopic channels, and we're heating up that tissue, those deep dermal layers underneath the skin. We heat that up, and what happens is there's healthy tissue around these channels. By keeping healthy tissue around the channels, the skin heals faster. You stimulate collagen, you stimulate elastin, and slowly with time, over 2 and 3 months, the skin will start to repair and build itself, filling in acne scarring, filling in lines and wrinkles. And also with the erbium, we treat the surrounding skin around the wrinkle. So not only are we, from the dermal layers, lifting the wrinkles, we are also resurfacing the surrounding. So we're actually kind of debriding and resurfacing the skin around the wrinkle. So it matches. So you're getting the effects both superficially and dermally.
Okay, so you could make somebody, we said, years younger without
Absolutely.
surgery. You could take somebody 50 and make them look 40, in your opinion?
Why not?
I mean, have you seen that in the
Yes,
practice?
absolutely. And you know what? Over a couple years, I have patients coming back in and they're reversing an age, and it's who doesn't want to reverse an age?
But we had a discussion in my green room over there, and it was very interesting what we were talking about, or what you were talking about, and that is that you could take somebody 35, and 10 years from now, they may look...
You know, we can't prove it, but in all honesty, I believe that in 10 years, they will look virtually the same. They will have probably even better. You know, the pores will be tighter, the skin will be smoother, you'll have that youthful, radiant glow that still looks natural. And that's what we want to focus on. And that's so many women, men too, they just don't want to look unnatural. And they don't want their friends to notice. So with gradual treatments, and especially with Fraxel, you know, the skin improves over time. And
but the downtime could be a couple of days? If you go light, 2-3 days?
If you go light, I just had it 5 weeks ago, and it was very light. And but if light is what you want, we can go light, and it takes 3 days. So it's 3 days. The next day just looks like you've been in the Caribbean for a really long time. You're a little brown and red and tight, and then it starts to just kind of slough off. And what that helps with pores. So many clients want help with the pores, just a smoother complexion.
So you're heating the fractionated laser, you're heating the underlying tissues,
right?
And the body repairs by laying
itself
down new collagen.
Exactly.
Filling in some of the wrinkles.
Exactly. Lifting those wrinkles.
Do you think people could avoid a facelift if they go in early? Your own personal opinion. You get somebody in the 28, 30 years old. I'm getting your opinion here.
Right.
And you do some of the Fraxels, and you do it consistently, and you do some of the treatment. Do you think that...
It's prevention, in one word. Prevention and maintenance. So I can't prove it, and maybe some people will need surgery.
Do you
I'm not
think
against.
your 35-year-olds and 40-year-olds in 10 years are going to look about where they look today if they follow your protocols?
Absolutely.
What about in 20 years?
No doubt. In
20 years?
20 years, I'd probably hold that too.
It's about the same.
Honestly, it makes such a big difference, and I'm very passionate about it, and just seeing the results firsthand and off clients, and it really makes a big difference, and we're all so excited.
So let's talk about red spots and brown spots.
Right, which is a major concern.
What can you do for those?
Well, pulse light is the most popular. You need a couple treatments. But it really targets pigment. Unfortunately, red is harder to eliminate than browns, but there is hope.
But browns, isn't that what most people, in your 40s worry about? Browns
absolutely, and especially living in the desert. Golfers, active lifestyles, playing tennis, that is the #1 complaint when they come into the office.
What about olive skin? Because I understand that there's a next generation of lasers that can do it. Can yours do it?
Absolutely. Olive skin. So if you have that darker olivey complexion, you can come in and it will be safe and effective for your skin type.
Laser technology.
Right.
And you think that's a future then? Of looking younger?
Gosh.
Is that part of every...
It's cutting edge. It's cutting edge. And it keeps changing. It keeps evolving. It keeps getting better. Before we had Retin-A and antibiotics or stripe, but now in addition to that, Retin-A is fantastic. I have a lot of clients on Retin-A. Okay. But there are other options. There are other options out there. And it's just, lasers are exciting.
They're exciting. Okay. And so if a patient's watching this, okay, so what is the questions you have for these people? How much downtime can you tolerate?
Right.
So like 5 days, 10 days?
Again, lifestyle. If you can tolerate the downtime, we can go a little deeper. We can really be aggressive with the skin. If you don't want the downtime, we can do another type of laser. We can do the IPL or the BBL. There's so many different options. So depending on your lifestyle and what you want to do, just come into the office. We'll assess the skin. We'll put you on a treatment program, and we'll go from there.
You see transformations all the time.
Absolutely. And that's what warms the heart. That's what makes getting up in the morning and going to work that much better, is the confidence that exudes these patients once they leave. Coming in and saying, "Oh my gosh, I've never thought that I would have a good complexion. I never thought anybody would ever say that to me." But there are options that you can have. There's hope, and you can get that self-esteem back. And
because people are dating. So are people, by the way, people that are watching this, 60s, 70s, 80s, that's young in the desert.
It is. It is young.
What do you say to those people that are maybe resistant to getting it done, getting anything done?
There's different levels. A lot of clients come in scared, not knowing.
What's their fear? What is their fear?
Well, we see on TV these Botox gone bad, or these chemical peels where you look really burned, and it's really not the reality of it when it's done correctly, and you really the results speak for themselves, and you see.
So you don't want to look like you've had anything done. You just want to look fantastic for your age.
Right.
Is that the goal?
Exactly. Natural beauty.
Because great skin, we talked off camera. I mean, look, women want to know what guys talk about. Okay, right? But behind their back, great skin is sexy at any age. When you see somebody with great skin, that's a standout.
Absolutely.
That's big. That's a big thing.
That radiant glow from across the room, it really does a number. And you don't have to live in the skin that you're in anymore. And you can really improve at any age. You know, I was talking about starting younger, but even if you start later in life too, it's okay. We can still achieve results.
Okay. Do you have a competitive nature where you say, I want to turn this around for these people?
I do, because of my past, and I know that it works. So I just don't want anybody to get frustrated and to give up. Because
are there people like that?
Absolutely.
They just think I'm too far gone.
Yeah, I'm too far gone. Oh, honey, you can't fix this face. Oh, I this old thing, and it's not the case. I'm not saying that we're gonna take, you know, and make you look
now,
like you're.
But it's affordable now.
And it's affordable. It's affordable. There's a lot of competition out there, so you kind of have to be affordable.
Thank you for coming on the show. Very good.
Thank you, Randy. Likewise.
You're watching The Wellness Hour. I'm Randy Alvarez. Up next, what you need to know about fillers. Are they a good idea? We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to look years younger without surgery. We're talking about fillers, facial fillers, dermal fillers, and Botox with the go-to person for Botox in the desert. And she is a registered nurse. She works with Dr. Mo Zachary, the board-certified plastic surgeon. It's Peggy Murgo. Peggy, welcome to the program.
Hi, Randy. It's an honor and a privilege to be here with you again. Thank
you. Say that, you know, for people that don't know, I've been going to you for Botox, I think, for at least 12 years, maybe
Since
13 years.
2001. That was the first time.
So I think, and I said this on another interview, I think that Peggy gives the best Botox possibly in all the world.
Well, thank you.
Because people think Botox, that it's all the same, but it's not. There's a lot of technique to it.
There's a lot
and
of
the way you do it, which I won't give away your secrets, but the way you do it is different than anybody does it.
I believe that to be
because you're fast.
True.
You do it kind of a.
Yes.
You have a little bit of a.
I think it hurts less when you're quick, and I learned that about 12 years ago to inject it a little more quickly so that it doesn't hurt. So I try to keep it as relatively painless as possible, and effective.
Okay, so we're going to talk about fillers today and Botox. For people that don't know you, by the way,
Yes.
what is your role there at the Cosmetic Surgery Institute? You guys also call it CSI.
Yes,
Okay.
CSI for short,
What's your role?
Cosmetic Surgery Institute of Palm Desert. Well, I'm a registered nurse, director of nursing. I worked in the operating room for many years, and I've been doing surgery and mostly fillers and Botox since 1996. And so that's my specialty area, fillers and Botox and some laser resurfacing. And so I kind of do quite a few things there, but primarily the fillers.
And you have a high-end clientele. You
Yes.
have celebrities, right?
Yes, we do.
And you have just regular people, by the way, now. Is that
Right,
true? I mean,
from
just
18 to
police
91.
officers, firemen. I mean, everybody's getting Botox now and fillers.
Yes.
Is that right? It's like mainstream.
I believe it's mainstream because of all the TV promotion and all the glamour shows that are on, and it's much more affordable now than it used to be. So I have clients from 18 to in their 90s. We have a number of clients that are in their 90s now that still come to us
Is
and
that
are
right?
still looking good.
Are there some people that are actually embarrassed that they get Botox?
Yes, they don't want anybody to know, and they feel guilty about spending the money on something that some people view as trivial. But I say if it makes you look softer and less angry and it helps you to feel better, why not?
3 guarantees in life. This is my joke. Death, taxes, and Botox. It works. I mean, it gets rid of wrinkles.
I like that. Can
It
I
does.
quote you on that
You
one?
can't quote me on that. Okay, so there is technique to Botox. So let's,
Yes.
for people that, by the way, they know about Botox.
Okay.
They've heard about Botox, but they can't get themselves to get it for fear of whatever. What do you
Right.
tell them? They're in their 30s, 40s. They've got these lines, forehead.
I hear a number of reasons for not wanting to do it, although they're interested, and they'll come in just to talk to me sometimes because they've been thinking about it for years. They see friends that have had it done and they're really looking good and they want to too. But the fear is, well, you're injecting poison. That's what I'm often told. Well, it's botulism. Botulism toxin, type A. It's 1/1000th of a gram. It's regulated by the Center for Disease Control
It's
and
safe,
the FDA.
though. I mean, it's proven to be safe
yes.
now. Okay.
And there's never been a recorded case of botulism from Botox, and it's been around a good 30 years in the United States. So for available for cosmetic use since 2001. So I've done sometimes in a year I'll do over 3,000 clients. We have a really big business, and I've not had any bad side effects or allergic reactions.
Knock on wood. Good for you. Good for you.
Thank you, God.
But Botox work. What's the most popular area for Botox?
Between the eyebrows. By far,
Right
between
there.
the eyebrows is the most popular. On-label use, that's what it is FDA approved for. Off-label use, we do sometimes foreheads, crow's feet, corners of the mouth to turn up the corners of your mouth, purses so people don't purse their lips as hard and look
I've
like they're
never heard that
sucking a
before. Let
lemon.
me hear that again. What is that?
The purse lip. Some people look like
So
they're
you
sucking a
Botox
lemon.
their lip?
So we put a little bit of Botox
can't
on
do
their
that?
upper lip, and it softens the purse so that they don't look like they're sucking a lemon all the time. And
Interesting.
it's genetic whether you have that. Some people don't. So there's many. We do it for underarms so that it helps you last up to 6 months so that you don't perspire.
Is that right? Does
You
that
can
work?
let go of
Does that
deodorant.
work?
Yes, I do it myself.
Does it hurt?
It doesn't hurt.
You're kidding
a little
me.
bit less than a facial Botox.
How come, well, it seems
actually.
like you would let your friends in on this. You've
I
never
do.
offered it to me ever.
Well,
never
I didn't
talked
think
about it.
you needed it.
Well, I didn't
know
want to
that was an
talk well,
issue.
because you never brought it up. I thought it didn't work.
It's
So it
called
works.
hyperhidrosis, and especially at the Grammy Awards and the Oscars when they're wearing those
Wow.
$10,000 plus dresses, they Botox their armpits so that they won't get stains on those expensive designer gowns. So it's quite a popular thing to do in Hollywood.
How often do you do this? Once a month?
Oh, with Botox
Under the
underarms?
arms?
All the time, but you
Like every week you
personally-
do it?
I
No,
would
I'm
on-
saying you personally.
Oh, it
As a-
lasts about 6 months, so twice
But
a
I mean,
year.
how common is this procedure in your practice?
Oh, pretty common, at least once or twice a month. It's because it costs a little more because you have to use more Botox. It's maybe not as popular as doing the little areas on the face. Between the eyebrows is by far the most popular. And that said, there are other botulism toxins out there now. We have Dysport by Medicis and Xeomin by Merz Aesthetics. Companies are always merging, and we have Botox. So we have 3 choices now.
What's
in
the best?
botulism
Okay, so
toxins.
let's talk about because I guess people look like they're mad, and this is one of those things that can make you not look mad or tired
What
or
happens
angry.
as we age, and again, you can look at mom or dad, it's genetic. Either your eyebrows tend to fall in as your brow is coming down with age and you look angry, or they fall out and you look puzzled. And so with Botox, you can keep those wrinkles away and kind of shape the brows back where they were when you were a little younger, and it helps you to not look puzzled or angry and tired, and especially wrinkled.
Okay, how does your,
Mainly
now with the
wrinkles.
forehead, so you do the forehead, crow's feet. I've heard some people say, there's mixed reviews here. Don't
Okay.
go into the eyes with Botox. Be careful around the eyes with Botox.
Well, you have to be careful, yes, because if you don't inject in the proper places, you can paralyze your upper lip temporarily, always. Botox is always temporary, but you have to place it correctly so that you don't
So
have
you're
that
not afraid
sunbeam.
to do that because you do
Not
it
at
for
all.
me.
Not at all. I have been doing Botox for 16 years. I do it, it seems like all day, every day during the week.
You've probably done
and
more
I know
Botox
where
than
it
anybody in the
needs to
desert.
go.
Is that true?
I would think so. I would like to think
I mean, you've
so.
done thousands
thousands
of Botox.
a year. Yes.
a year.
So for
But
many
is there a
years
learning
now,
curve? I mean, are you that much better now than you were when I first met you?
I
Do you think?
believe so.
Because
Well,
Botox seems straightforward. I mean, but are you that much
no,
better?
there's a very advanced Botox injection, and there's beginner injections. In fact, I'm training somebody this week. I train doctors, nurses, and physician's assistants to do Botox. So I've been teaching it for a long time. And I usually tell you, in your first 2 years of injection, just stick to primary injection technique. And then when you get really comfortable with where you're placing it, you can evolve to more advanced
So if you
technique.
go to somebody that knows what they're doing and they get it done right the first time,
Yes.
ultimately it's less expensive to go to somebody that knows what they're doing.
Exactly.
Is that right?
Because it will last longer, it'll work
Good.
better.
Okay. Fillers.
So
Let's talk
it's
about
true.
fillers. Let's move into fillers.
Okay. So many fillers. It's
So let's
really,
then begin with who should get dermal fillers and what could it do for your appearance?
who should get dermal fillers? Well, again, it comes down to genetics and the things that bother you. The most common area, again, nasolabial folds.
That's this area right here.
Yes. I have people in their 20s, especially really athletic, fit people, that begins to show up in their mid to latter 20s.
Now you say it can soften the appearance. Elaborate on that.
Yes, it absolutely softens the appearance, and that's why I get some of the younger gals, especially the very lean, fit, athletic people, they have a low percentage of body fat, and the folds begin to show on their face, and it makes them look harder. It makes them look a little older and they're
Okay.
not that old. So it makes you look harsher and older, and when you add in the filler, they just look softer and prettier. And it's not something that people will look at you and know what you've done if it's done well. They'll just look at you and think, wow, you're looking great. You're looking rested. Did you change your hair? They won't know. So that's how it should
What
be done.
about the older
subtly.
patient? Is it becoming more popular?
Very popular with the older patients because people are living much longer and they're living a fit, healthy life, and they want to look as good as they feel.
Why are some of the, what are the ages of some of the oldest patients you have that get fillers?
I have a handful of clients in their 90s, 89
You
to
have gotta be kidding me.
91, that have been coming to me for years, and they still look great. You would never guess their age.
Is
And
that
usually
right?
they're women dating younger men. I have a few men dating younger women, and that's why they come to me, because they don't want to look as old as they are, because they feel young inside and they want their outsides to match.
Somebody said, or no, we had a conversation on the phone. You said a lot of the 80-year-olds in the desert, Randy, let me tell you about them. They're really 90-year-olds.
That's true.
Because they look younger with fillers and
It's
Botox.
true.
That's so interesting to me.
They don't ever tell their age.
Let's talk, though, about, because you brought up an interesting point, that there's a lot of overfilling done. That memeans overfilling the face.
Hollywood
What does that
today, and in fact, even sometimes where we live on El Paseo, you'll see a little bit of overdoneness, and I think they have too much in their cheeks, too much in their lips. We call it the teddy bear look. When they have too much around their nasolabial folds and marionette lines and lips, they get kind
Like
of a
they're just
teddy bear
overfilled.
look, or kind of like a real snouty type of look, and it doesn't look natural. And so they're trying to correct some problems, but they're looking kind of artificial, plastic, and like a teddy bear, instead of looking softer, prettier, younger. So our goal at the office is to have people look natural and restore, have you look softer, younger, fresher. We don't want you to
Nice.
look fake and plastic.
Let's talk about under the eyes, bags under the eyes.
Absolutely.
Do you fill that area?
Not always. In very few cases will I try to add to the bag directly under the eye. There's a few people that can get away with filler there, but most people, when it's the under eye bag you're talking about, need to see Dr. Zachary and have fat pads removed or have fat added. It's a whole other way to go. So I'm
Dr.
very
Zachary
honest.
is big on that, by the way.
He is. He has it down to a fine science. I think there's nothing better that you can do for bags under the eyes than talk to a
Adding
surgeon
your
like-
own fat under
adding
your
your
eyes.
own fat, or removing a bag if need be and putting some fat back in. It's the best, most natural, longest lasting way to restore under the eyes. But that said, if it's just a subtle problem, sometimes you can correct right under it and restore the cheekbone area, which will then camouflage under the eye. So that's what I do, and that's when people come to me. But if it's a little bit, they've waited too long, I refer them to Dr.
Now,
Zachary.
you do over 1,000 Botox procedures a year.
Yes.
And what about fillers? Would you say you do 1,000 filler procedures a year?
I
at least?
probably go through, I couldn't say for certain, but I'm estimating probably about 1,000 syringes a year. I order like cases of 30,
So you've done
40 at a
thousands,
time.
over
and-
1,000 patients of
Oh
fillers.
yes, in a
How long
year
have you been doing
probably.
fillers, by the way?
16 years. Started with
16
collagen.
years.
Back in the day, collagen was all that we had, and so some people will remember that. But now we have so many choices.
Are men getting fillers, by the way?
Yes.
Really? Okay.
Yes. I do see a lot of male models that come to me. A lot of them live in South Beach and Palm Springs and come back and forth, and they often seem to know each other. So I have quite a clientele. These are good-looking models, but they begin to age, but you'd never know it.
Is that right? So people, I mean, so fillers, as long as you don't overdo it, because we've had this
Yes.
discussion. I feel like I could spot overfilling a mile away.
Yes.
So, and is that in the hands? But I don't know. Is it the patient asking, "I want that look," or is
We
it
get that.
or is it the
It has
person?
to be the injector, because I know I will tell people no. I don't like to tell people no, but at the same time, I'm not going to make somebody look freakish or fake. And so when they want an overfilled look, I do have peers in the desert that will do that, and I'll refer them to someone
You do
else.
lips too, right? We haven't talked about lips, but
Yes.
you do lips.
Yes, because as we age, we lose lips. So
But you
lips
like
are
natural
very
lips too,
popular.
also.
Absolutely.
There's a lot of that
Absolutely.
going on too, right? Overfilling lips.
Yes, I think that has slowed down quite a bit. We had
Okay.
quite a rage a few years ago where everybody in town were doing those big overdone lips, except for me. I refused to do them. And I'm not seeing it as much anymore.
Is that the trickiest of all of the procedures that you do? Is creating a beautiful natural lip?
No,
No?
I think it's probably one of the more simple personally. It's
Interesting.
what I love to do lips. I love full lips, but I want them to look natural.
So what's the
not
trickiest
fake.
for you to do that maybe the public
trickiest,
doesn't know?
I think around the eyes is the most highest
Adding
technical
fillers
area
and
to
things?
fill. That said, I consider this my artwork. I love to do it. I want to restore, and especially on women, what ages them the most, in my opinion, is around the eyes.
Around the eyes.
So that's the area you want to cinch, but that's also the area where you can get very freaky looking if it's not put in correctly.
So you've been doing fillers now for 17 or 18 years?
16.
16
well, at least
years.
16 years,
16
since 96.
Now, experience matters, and you know, people come to me all the time on the web. They'll say, "Who should I do?" I said, "Well, ask the doctor. How many of the specific procedure have you done, or procedures have you done?
Yes.
How long have you been doing the procedure?" And they never ask that question. I'm so surprised.
In fact, I have a lot of snowbirds, we call them in the desert, the Canadians and people from Montana, and a lot of people that just come out here seasonally. And I tell them, if you need to do fillers or Botox touch-ups during the summer when you're not in the desert, make sure you find somebody in your area. Maybe go to some of the websites. Make sure they've been doing it at least 2 years or more. Get word of mouth and take a look at their work, because you don't want to go to just anybody.
I'd be afraid to go to someone else.
Oh, well, thank you, Randy.
When do you know you need a filler, by the way? When it's bothering you?
Well, if somebody points out you're looking older, if you're seeing
Well,
pictures
who says
of yours.
that? Do people say that?
Yes.
You're kidding me.
I think the number one
terrible.
reason people come to me is somebody pointed out to them that, you know, they're looking older, they're looking angry, or I'll hear this.
Oh,
they keep
okay.
saying I look angry and tired, and I'm not angry and I'm not tired. Well, that's a good reason.
I found that out. You're not supposed to say that to somebody.
Well,
You look angry. I'm not angry, they'll say.
Exactly, and that often
People
will
say that
drive
to
them
me.
to take a step. And well, not if your Botox is
Right,
working.
no, and then I know I have to go see
then
Peggy.
you'll know it's time.
But I will tell you, I refer everybody to you, and I know the
Thank
best in the
you.
business. But how about this? I'm going to I'm going to try to stump you here. Not stump you, but put you on the spot. I have certain plastic surgeons that say, well, an RN probably doesn't do it as well as I do because she doesn't understand the anatomy. That when I'm going in with Botox, I almost see the muscles that I'm injecting.
Well, I would say to
What's your
them,
response?
I worked as a first assistant in surgery for many years, so I've been in the
You've seen
operating
hundreds
room.
of facelifts.
Yes, so I know what the muscles look like under the skin. I've been there, done that for many years, so I think that helps me in my practice. That I know what it looks like. I know where the muscles are, the blood vessels, the nerve bundles, and you absolutely want your injector to know those things.
Okay, Peggy, always a pleasure. Is there anything that when you drove over here that you wanted to mention that we haven't talked about, or did we talk about it all?
I think we've pretty much covered it. Just, you know, I just really feel the need to say I'm so blessed to work for Dr. Zachary and a wonderful group of people that we've been together for many years, and we just like to make people
Hey, you guys
feel
have all been
beautiful
working
and look
around
beautiful
each other for a long
for a
time.
long time. And I think we have a really good success rate, and
Good.
we love what we do, and we just want people to be happy.
All right. I want to thank you for coming on the show. Always a
Thank
pleasure,
you,
Peggy. Thank you
Randy.
so much. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this online, you can go to our website at wellnesshour.com and you can put in Botox or you could put in Peggy and you'll find her there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.